So we're here at London Spine Clinic with Nigel Gildersleve, who is the osteopath here in Harley Street. We're just doing IDD therapy treatment and training. Nigel is enjoying his own session. Nigel, just thought it'd be interesting for you to share with your patients how and why you came to have the IDD therapy. You had some treatment somewhere, or you had a back problem? What was your experience?
Well, it was a long-standing injury following awkward, heavy lifting, moving house. And it turned out to be a big bulging disc at L3-4 that, fun enough, wasn't massively painful at the time, but it was just complete numbness to the whole of my anterior thigh, front of my left leg, and loss of knee-jerk reflex, and in fact muscle weight weakness as well. The pain was in the back rather than in the leg, so I was quite lucky there. But then 20 years later, obviously most of that had recovered, but what was left was just a really, really stiff, uncooperative low back. And the typical picture was every morning I'd be sat on the bed, sitting upright, unable to slump into flexion forward bending to do simple things like putting socks, shoes, trousers on. And so I thought that I wanted to look at this machine as an addition to the treatments we could offer here at the clinic. I thought, well, I've got to test this on myself and see whether it makes a change to my grumbly old disc and maybe jammed up facet joints in my low back. I had one session on a Wednesday night, and I remember Thursday morning, next morning, I was able to slump completely into flexion for the first time in absolutely years and years, completely pain-free. So it worked for me as an absolute miracle in unjamming my old, worn-out back. Obviously, I didn't have raging sciatica, so I can't comment on that. It wasn't that treatment for me, but in certainly freeing up movement in my low back, superb. Absolutely superb.
And in terms of freeing up, presumably you'd tried other things too.
I'd had mobilisations, some manipulations. I tried to stretch my back off myself, but I think some of those facet joints were just so restricted and tight from possibly not enough treatment over the years, but because you tend to treat everyone else and neglect yourself when you're a therapist. Right. But it seemed to really break apart that jammed up low back and created a change in the disc and the facet joints, and the freedom of movement now is just it's unbelievable.
Okay, well, thanks for that. So you've got a bit more time on this treatment. Enjoy.
Thank you.
Yeah, thanks for that, Nigel. That's great.
Cheers.